Hello YouTubers, it's Arya here. Welcome back to my channel. It's called Screener and Opioid Assessment for Patients with Pain. Okay, so then it has a short description, so I'll read that really quick. It is used to help clinicians determine how much therapy a patient being considered for long-term opioid therapy might require. And then it has like a graph here that I will go ahead and insert a picture. There's 24 questions, you guys, so I'm going to try to make this quick. Okay, the first question, how often do you have mood swings? I answered never. How often have you felt a need for higher doses of medication to treat your pain? I answered seldom. How often have you felt impatient with your doctors? I answered never. Oh, how often have you felt that things are just too overwhelming that you can't handle them? Sometimes. How often is there tension in the home? I put often, but I think that was like a typo of me. How often have you counted pain pills to see how many are remaining? How often have you been concerned that people will judge you for taking pain medication? How often do you feel bored? How often have you taken more pain medication than you were supposed to? How often have you been worried about being left alone? How often have you felt a craving for medication? How often have others expressed concern over your use of medication? How often have any of your close friends had a problem with alcohol or drugs? How often have others told you that you had a bad temper? How often have you felt consumed by the need to get pain medication? Oh my god. How often have others kept you from getting what you deserve? Out of all of these questions, I answered 4 of the 24 questions differently. Okay, the rest were never. And my score, I scored a 7. Okay, so what does that mean, you might ask? Well, looking at this table here, if you score a 0 through 9, it's a negative. So you're at low risk. Patient has likely tried and been compliant with many other types of therapies. Patient should be able to safely handle medication with minimal monitoring. So that's like great, right? Because that means like you're not red flagging the person who's doing the psych eval, and you're not showing any like signs of misuse, I guess. And you guys, I hate this screener. Like I said, I scored a 7, but you guys, I don't want to say too much on here because, you know, what if somewhere down the line my providers or who knows who finds this video, and then, you know. But I do want to just, if anyone was to answer like never to all these questions, I'd wonder if they would even be human. Because I mean, how is it possible when you have chronic pain, and especially over like years of chronic pain, how is it possible that there wouldn't be like one time that you wouldn't feel impatient with your doctors, or like that you felt like you needed higher doses of your medications? Or even how often do you feel bored? I can't really make the connection on why that's a risk factor or not. Like, that's so strange to me. And the thing is, like, this question, how often have you been sexually abused? It's phrased really strangely, because if I remember correctly, your options were seldom, never, often, sometimes, and maybe like almost always, or something like that. It's just phrased really strange, right? And like, I feel like they're treating everyone to live a sheltered life and not be subject to any of these things. But the thing is, you guys, we are all human, and we at times can't control the things that happen to us, or how others react, you know. So I think it's just like an unfair screening to do on someone, because like, who doesn't have mood swings, you know? And like, if you're, you know, pain is like different for everyone, and some pain is harder to treat than others. And you know, when you have a rare disease like I do, everything that everything that you try is off label. So how do they not expect you to use to feel the need for needing a higher dose of pain meds, like especially if you're like in a flare-up, you know? And then how often have you felt impatient with your doctor? Personally, I was seen by three doctors before I was diagnosed with CRPS, or four technically. Four doctors. Okay, so like, do they expect me not to feel impatient at all during that time when I was suffering and didn't have a diagnosis and I was being told it was all in my head? And then how often have you been concerned that people will judge you for taking pain medication? I put never, but you guys, it's like an environment, societal thing. Like, there's so much stigma around controlled substances, even stigma among providers. Like, in my experience and in other people that I've talked to, like, providers don't want to prescribe pain meds. Like, they just don't want to. They don't want to prescribe controlled substances. And we all know, because that now, like, regulations are tighter because of like the opioid epidemic, but like patients who have pain are left to go without pain relief, you know, unless it's like invasive procedures like a nerve block or spinal cord stimulator or a pain pump. Yeah. So, like, yeah, even with like Adderall, like, I felt, because there's so much stigma and you hear about how Adderall is like misused a lot. That's what you hear. You just hear those things. And so how are you not gonna feel like concerned that people will judge you for asking for medication that you now, like, I think it would make sense if they were to ask more questions geared towards like actual, like, I guess more, I don't know how to explain it, like tangible questions that you can, like this question here: how often have you felt craving for medication? Like, yeah, usually if you're not going to misuse your medication or feel like you're addicted, like, you probably wouldn't have like a craving for medication, right? Like, it's not like you're like ice cream, you know? If you don't have a problem with your meds, you're not going to like feel like, oh, I want to indulge in that and crave it, you know? So that makes sense, right? How often have others expressed concern over your use of medication? Like, even my family has expressed concern, but it's only because I get drowsy from my medications. Well, this used to be more back then. I got drowsy a lot from my medications. I was on muscle relaxers. Those are side effects that are expected. Yet, this makes it seem like, this kind of insinuates that they would be concerned because you're taking too much, or, you know, I don't know. I just hate this. I hate this because if someone were to answer honestly, like, how often have you been sexually abused? That's something that you can control, you know, and for that to become an automatic risk factor is just kind of unfair, you know? Often have any of your close friends had a problem with alcohol or drugs? I don't know. Okay, you guys, I know. What's that saying? Birds of a feather flock together. But you guys, I will tell you, when in my experience, well, I don't want to say too much, but I will tell you. Okay, I'll use like an example. So, I mean, I have a cousin, and you know, she had friends that did do drugs, and my cousin she never did these drugs, and she never had like a problem, even though her friends did show signs of having a problem. So yeah, yeah, birds of a feather flock together, but at the same time, like, you can't group everyone into, just because your friends have a problem doesn't mean you have a problem also. I don't know. It's just, I don't know. Okay. And then, how often have others told you that you had a bad temper? I answered never, but you guys, like, when you're in chronic pain, how do you expect, how do they expect you not to be in a bad, not to have a bad temper? You know, like, you're more stressed, you're running on, like, you know, you're stressed, you're probably experiencing lack of sleep, you're probably not eating really well, and you're feeling pain and it's interfering with your life. So how do they not expect you to have a bad temper? How often in your life have you had legal problems or been arrested? I answered never. Well, when she did ask about this, I told her about workers' comp. Like, I guess that's like the only legal problem that I've had. Oh, actually, this was completely out of my control. It was out of my control, and I don't even know if I want to go into it in this video. Basically, well, gosh, I don't even know if I want to go into it really, but yeah, maybe I won't go into it. But the only thing I said was the workers' comp. But you guys, I don't know, I just think the screener needs a lot of work. Like, I don't like this, because people that actually go through shit in life, like, they're the ones that need help. So, and sometimes you can't control your circumstances, you know? You can't control your childhood, you can't control what other people do, you can't control what family you're born into and how they act. So that's why I hate this screener. And if I would have answered differently, like, it probably, honestly, I don't want to say anything on camera either, but like, I would say, how do I say this? If I would have answered these questions differently, I would say that I would have probably scored in a different group, in a different group number, you know? And then the thing is, I realize exactly what these questions are doing, even like during the test, because it doesn't give you headings or anything. It doesn't say, now talking about anxiety, now talking about depression, now opioid misuse and all that. It doesn't give you subsections. They're just questions mixed in together. It does kind of group them a little bit, but like, obviously it's clear, very clear, what these questions are implying when you're taking them. But, well, I guess, but it may not be so clear, because I know on the other portions I answered very differently. And so the overall thing of my rating was I scored a lot lower on the disability rating scale than I know I really am. Wait, does that make sense? So based off of my answers, the test showed that I have less of a disability. But the thing is, you guys, I know just how much more moderate or severe, you know, CRPS has affected me. This is like a test that really should have been given to me there, and I would have liked to talk to her first rather than me doing it at home, because in the back of my mind, all that I could think about was, okay, if you don't want anything to be found out in court, then don't answer it, or blah 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 blah, you know? Like, whatever you don't want getting out, just leave it out, and just, you know, don't even go there. Because, you know, I am still in like a workers' comp kind of thing. And so I just, at some point, I mean, my lawyer told me just the other day, she called me, she told me they're going to want your records of your treatment for your leg. And I told her no, like, they're not entitled to my records. They're not even paying for my treatment for my leg, so why do I have to give them my records? Okay, thank you guys, bye.